This is now week 12 yarn. This is your awareness, your resilience, your nurturing. Excuse me. Normally this is where we tug on one health thread each week. The science, the why, the how, and we're going to unravel it into something that actually, hopefully, makes sense. Sometimes I researched it. Sometimes Calico researched it. Okay, a lot of times Calico researched it, and then I confirmed it. Trust but verify, y'all. But either way, still your yarn. Alright. So last week was fun. Well, okay, I had fun. I can tell you that much. I had a lot of fun making last week's. When we talked about what makes you move. That I almost stepped on frogs. Or that I yell, sing things at 10 p.m. so that way my neighbors can question my sanity. And I gave a PSA about fixing your pets. The difference between ferals and strays, etc., etc. Serious topics, some of them fun. But this week, we're going to go over something different. Because, of course, everything, it's just as it kind of pops in my head, I figure something out. This week, and I think it's because of those, now if you watch video 1, I talked about how my blood pressure is starting to kind of dip. And it was dipping in the afternoons. It's actually starting to go into the low end. And I was thinking about it. And I was like, now that I fully think about it, white coat syndrome. And that is what we're going to talk about this week. So yeah, it's a thing. This is also why it's very important to keep track of your blood pressure. Even if you're not on blood pressure medications, even if you're not being told that your blood pressure is too high, maybe not as track as often as I do, but, or somebody that does take those, but kind of keep an eye on how it's going. There's reasons why. Now, white coat syndrome, I know I definitely have this, by the way. Yeah. Now, am I saying that I don't have high blood pressure? No. I mean, I'm going to talk to my doctor when I see him in October. Because again, if you didn't notice, I'm having some low things now. But we'll talk about that. Okay? So white coat syndrome is also called white coat hypertension. Now this is when your blood pressure reads high at a healthcare provider's office, but it comes back normal when you get back home. Now the name itself comes from the white coats that the doctors and nurses traditionally wear. What's actually happening is your body triggers that stress response that we talked about. It's that low-grade fight or flight reaction. And it's just from being in that environment, or even around that environment sometimes. It's an anxiety of the setting. It's basically, that exam room or the art, just the act of getting the cuff put on or anything else. There's certain things that can trigger it. It can cause a real measurable spike. Here's the thing. It can happen even when you genuinely like your doctor and feel fine walking in. Your body just has that reflex. It affects 15 to 30% of people who have a high blood pressure diagnosis, and it can happen to people without one at all. It tends to stick around, and studies show it doesn't just go away over time, even if you've seen the same provider every year for decades. Technically, to diagnose it, a provider does need at least 3 high blood pressure readings in office, and then alongside with normal readings taken outside the office. It's either with a home monitor or a 24-hour, it's called 24-hour ambulatory monitor. It's this little device that you wear that takes your readings throughout the day automatically. I did not know about those. I want one. Unless I got to stick it. No, I don't know. I'm going to look it up. But yeah. But apparently it takes your readings throughout the day automatically. So basically, let's say you're in office, your blood pressure might be 140/90 or higher. And then you go home and you take it, it's like under 135/80. Why does this matter though? It is not completely harmless. People with white coat syndrome have a slightly higher risk of eventually developing true high blood pressure. About 5% per year progress to real hypertension. It is worth keeping an eye on, even if you're currently fine outside the office. You want to think about like your body's alarm system being a little too sensitive. It's not broken, it's just jumpy. And jumpy symptoms can wear out over time. So here's my story of the fun I've gone through. This is about me, doctors, dentists, just healthcare professionals in general. I just get really anxious around them. It doesn't matter. As soon as I'm in that waiting room, it's there. It's always been this way. And it's probably because they're usually sticking me with some kind of needle for something, especially now. I know, at least now I know when I go in that they're going to stick me with a needle and draw some blood. Where as a teenager you're going in and you're like, is it hit or miss? Are they going to stick me with some kind of injection today of, oh, you need to do this kind of shot now? Me as a kid, you did not want to see my fear of needles when I was a kid. That was a whole different story, by the way. Really quick, I know, like I said, today I'm going to go off on tangents, but so when I was younger as a kid, when I was little, or let's start when I was little. When I was little and they tried to put a shot in me or take blood or whatever, what I would kick, I would scream, I would bite. I became a teenager and I still remember not knowing so they said something like, was it that TB test or something like that? Like, it used to be this little, like, stampy thing, and then your nurse at your school had to check it or something. And they're like, oh, it changed this year. And I was like, okay. Or, no, it used to be that we could check it. And then they said that what changed this year is that it has to be checked by, like, the nurse at my school. And I said, okay, cool. Just like this little, I know there's a little needle, but if I can't see it, I'm usually okay. And I'm talking to my dad. I think I had to be I'm like 16, 17 at this time, mind you. And I turn around. Now, the other thing they didn't tell me the difference was they were about to stick a big old needle in my arm, apparently, for this little thing to be checked. And I noped it out of there. And my dad apparently is a lot quicker than me. And I had a hoodie on, and I just remember him grabbing my hoodie. Like, I'm booking it. I literally booked it out of the doctor's office. And there are kids, because I'm still technically like a kid, but not a kid, you know, and there are kids everywhere. And I'm booking it. My dad he gets the thing in my hoodie, the hood, and he yanks. I had to do it. That was me as a teenager. I can laugh about it now. As I got older, like I had to have, what was the injection? I don't know, because I was a cook. This injection thing, I don't remember. Well, okay, no, I started to have blood tests taken more and more because of the family history of diabetes and, of course, stuff like that. My grandma used to have to come with me, or my stepmom or something like that. And I didn't kick and bite or book it anymore, but I did cry. And, I would hyperventilate to the point where they almost wanted me to lay down. I'd freak myself out. It'd be bad. And then after a while of being poked and prodded, honestly, nowadays, I still, like, close my eyes and, okay, go ahead, and just hope to God that they get the vein right, or it doesn't blow out. And, I'm usually fine nowadays. I don't cry anymore. I still freaked. Anyway, I don't do needles. I have a phobia of needles. I don't like them. Better than when I was a kid, I still don't like them. And yes, I have tattoos. I have 9 of them. It's a different thing. But even then, even her tattoo, I have not been able to watch them actually being done. I just, go ahead. Just kind of like the shot. But they are different. Either way, phobia needles. I go to the doctors. There's usually a needle involved. Anxiety goes up. Whatever. Speaking of the blood pressure, though. So, once upon a time, my little sister, who I love dearly, was in college. And she's in college to be a dental hygienist. Yes. She is one now. She absolutely needs to move to the same state as me so I can stop panicking that badly every time I have to go to the dentist. But I digress. Just to let you know, she's awesome at her job. If you know my sister, go to her. She's your best chance for a dental hygienist, okay? Anyway, back then, we're going to call it voluntold. She asked, I said, okay, I kind of felt like it. She's my little sister, okay? To be basically her practice patient. You know what things are. Come on, Lily, will be fine. I just need someone to sit in the chair. Sure. Whatever, fine. I love you. Let's do this. So I think it was about it's like the first time, and she takes my blood pressure. Yeah, I know. You don't see this a lot with dental hygienists, but part of the schooling especially, I guess they have to, you'd have to ask her what the whole thing is. And it's still a medical thing. They're going to be in your mouth and stuff, so they kind of need to know your blood pressure. So that would make sense. So she took my blood pressure. And I had just driven an hour to get up there. Plus, again, I'm about to be in a dental chair with my little sister, who I tortured for many, many years, with sharp objects that I had no defense against. If you know, you know. She wasn't going to kill me, but she could. Anyway, no, I'm kidding. I love her. But, yeah, my blood pressure was just high. It wasn't like call the ambulance high, but it was like, it's kind of spicy high. So as we wait, we chat, she takes it again, and it's basically back down to normal around my sister. And that is classic white coat syndrome. Especially then, for me. And like I said, it's because I calmed down, and again, it was my little sister. Yeah. But anyways, here's the part that I didn't fully realize until later, because I will bring up to people, yeah, it's going to be a little bit higher because I'm in the doctor's office, but I didn't actually know about this. My sister did tell me, so apparently when you're in school for dental hygiene, just let you know, you do have this kind of like, I guess, a final exam or something where you work on a patient and you do like this whole set of procedures, practical, basically, practical, I don't know, a capstone, prove you can do this without accidentally sanding somebody's gums off. Moment, basically. My sister, bless her heart, wanted me to be her patient. I do know that. Her instructor basically took one look at everything that's been happening, because she saw me a few times and she said, no, she's not a good candidate. Fair. Like, one, I'm going to be completely nervous and she's working on me. And she's a dental hygienist student, so me being completely nervous is probably going to make her completely nervous. And this could end up bad for both of us. I do try very hard to be supportive. But just to let you know, dentists of any kind, even my little sister, make me nervous on a cellular level. My teeth, not so great back then. Let's be real. Now, once my sister got a license and can work on me outside the student clinic, she made sure I was fixed right on up. And like I said, best dental hygienist I've ever had. Shout out to you, little sis. I love you, but also, sorry, I tried. Anyways, that whole moment, that whole blood pressure spike, the anxiety, the nope, she's not exam material, that was my first real obvious textbook example of white coat syndrome. I wasn't scared of her. Maybe a little. Still am. No, I'm kidding. Anyways, I wasn't scared of her. I wasn't scared of the school. I wasn't scared of the room. My body just went dentist, nope, fight or flight time. And that is exactly what white coat syndrome is. So anyways, let's fast forward a few years. I have a new doctor. I have a new doctor, definitely heavier than I was now. This is probably around 2022. I go in, my blood pressure is high again, and I explain it to her. This is what normally happens, right? And her response, well, the medications I'm putting you on for diabetes will probably raise it, so we're going to put you on it anyways for preventative measures. And I'm already scared out of my mind. It's a new doctor. I had other things happen, which is why I went to go see this doctor. I already knew I had high glucose, all kinds of stuff, so I trusted her. Not my favorite doctor, by the way. Just whatever. Now, I don't see her anymore. Thank God. Now, a little bit of side note. Now, there are some diabetic medications that can raise blood pressure. And I'm going to try and pronounce these. I have attempted. I have failed. We're going to try it anyways. The main ones are called thiazolidine Dionese. I'll put it in a picture somewhere. But basically, these are older oral medications like, oh god, pioglitazone, which can cause, which can cause the body to retain fluid, and that fluid retention can cause the blood pressure to go up. High doses of insulin over time can do something similar. However, and this is important, a lot of the newer diabetes medications actually do the opposite. Those SGLT2 inhibitors and the GLP-1 receptor agonists, words. Now, these are more common now. I'm actually on one. Are actually associated with lowering blood pressure. Now, I do want to let you know those GLP-1s, I know you're hearing them a lot, like for weight loss and stuff. I'll be honest, I am on one. Why am I on one? It's not for weight loss. Was I like, oh, cool, I can lose some weight on this? No. I am on it because of my diabetes, and I really do think it's helped me out greatly. Cool side effect? Yeah, it actually, I feel full. I'm actually not sure how, I should look up how those work. But I do feel full a lot faster and stuff like that. But you know what? I put in the work too. I exercise a lot. I watch. Anyway, I'm not going to go over that. We'll go over GLP-1s at some point, especially with diabetes versus weight loss and stuff like that. We will. But anyways, just to let you know, GLP-1s nowadays, they are also associated with lowering blood pressure. So, again, even with diabetes medications and stuff like that, it's not a blanket statement. And even with the ones that can raise it, it does vary by person. Yeah. Anyways, going back to that doctor, I think what actually happened in her mind is she went fat person. She's lying. All fat people have high blood pressure. I'm not fully disagreeing with that, in all honesty. But, why I say fully, it is a high correlation. Correlation, this means, is that it doesn't mean everyone. Correlation means high blood pressure, somebody of higher weight, happens a lot. Correlation. I'll put a little thing of exactly what it means. I did learn a lot about it in psychology because you learn about high correlation. Such as if you have a umbrella, does it mean it's necessarily raining? No. There's a high correlation that there's a lot of people out with umbrellas. It's probably raining. But it doesn't mean it's raining. So fact. Correlation, not fact. So, yeah. Okay. I would think. Correlation. So yeah, it is a high correlation of that, but it's not 100%, basically, is what I'm trying to say. Anyway. So, yeah. Pretty sure that is what she thought. And I'm pretty sure that's why she put me on it. And I'm not sure if I had high blood pressure at the time, or if it was just I went to the office, I had high blood pressure because white coat syndrome. I'm scared of doctors. And she went, I don't think this girl knows what she's talking about. I'm going to put her on anyways. And she proved over time as to why I shouldn't have been seeing her in the first place. Long story short, yeah. So, just saying. Keep an eye on things. That's why you want to do it. Alright. 20 minutes. Hold on. Yeah, see, I told you going ahead and stay. Anyway. Let's move to last year. I get a new doctor. I gave up with the other one. Part of the reason things happened last year is because I gave up with doctors in general in my area. Because they all suck. Okay? And I just went, fine. You know what? Just not going to do it. Talked about it in my very first video. I gave up. But yeah, as we said, things happened last year. I had a seizure. I got a new doctor. Why did I see the new doctor? Various reasons. It wasn't for what I was supposed to be seeing him for, but whatever. I went to go see the new doctor because I needed a note for work. And I needed people to shut up. That's why I went to see him. But, very good doctor. Very, very good doctor. Very glad I'm seeing him. So new doctor. Anyway, the new doctor, he listens to me. And now mind you, he got me right after, literally within a week after I had gotten out of the hospital after having a seizure for high glucose. My A1C was 13 point something. We're going to put that at not great. And I also had high blood pressure. I don't remember what it was, but apparently it was through the roof from what the basic sayings that I kept hearing, through the roof. So equals not good. Can I blame him for putting me on blood pressure medication? Yo. But it's now a year later. My blood pressure is starting to be low. Like it's normal, which is great, but I'm also seeing low. So it's not dangerous, but it is enough to notice that brain fog every once in a while. Like I didn't quite notice it, and then I started thinking about it. I'm like, yeah. So basically, do I have white coat syndrome? Yes. Do I not have high blood pressure? I don't know. It could be the medication why it's dropping so low. It could be because I've lost over 70 pounds. Could be both. If you actually have normal blood pressure and you're put on blood pressure medication, it may not affect anything at first. Your blood pressure may stay normal, but it can also push you kind of into those dangerous lows. So now low blood pressure, this is called hypotension. It can cause dizziness, the brain fog, the fainting. If it gets bad enough, it can be serious. So again, gotta keep track. Talk to your doctor. Figure this out together. Is it really high blood pressure? Is it white coat syndrome? Is it both? Yeah, they're not mutually exclusive. Just to let you know, you can have genuine hypertension and white coat syndrome on top of it. And that's why your home data matters. Now, even I miss days, but I try for 3 readings a day when I remember. Either way, the data is yours and it matters. So, if you're like me, you're anxious at appointments, your heart is racing before that cuff even gets on, don't panic. You are not broken. You are just human. Very important, just track your numbers. Notice the patterns. Bring that information and that patterns to your doctor. If your readings are bouncing around, ask out maybe a 24-hour monitor, apparently. Apparently it's not fun to wear. I'm looking this up later. Anyway, but it does give real answers. At the end of the day, your health data tells your story. It's not just the 5 minutes that you spend in that cold exam room under fluorescent lights. So, we're going to switch over to Professor Calico like we do every yarn, because she likes to give us knowledge, and again, I'm going to put them little pictures, and someday we will have some little stuffy, and I don't know when, but we're going to do it. But anyway, pretend it's Professor Calico, because I promise I do not have 2 personalities, I just like to pretend. Alright, she says, alright, whiskers up. It is time for today's knowledge drop. White coat syndrome, also called white coat hypertension. It happens when your blood pressure jumps in the moment that you step into a medical office. Not because something's wrong with your heart, but because your nervous system takes one look at the exam room and goes, danger. It's a stress response. A tiny fight or flight spike triggered by the environment. The cuff, the room, the anticipation, the fluorescent lights, all of it. Even if you adore your doctor, your body may still panic like it's being chased by a vacuum cleaner. Here's the important part. At home, your blood pressure is normal. In the office, it's high. And this is not rare. It affects 15 to 30% of people. It's almost 1 in 3. To officially diagnose it, providers look for a pattern. At least 3 high readings in the office and normal readings outside the office, either with your home cuff or a 24-hour ambulatory monitor. That's a little device that checks your BP all day while you pretend it's not squeezing your arm every 30 minutes. In office, white coat syndrome looks like 140/90 or higher. At home, normal is 135/85. Now, is it harmless? Not entirely. People with white coat syndrome have slightly higher chance, about 5% a year, of developing true hypertension later. It's like having a jumpy alarm system. It works, just a little too enthusiastically. And yes, you can have both real hypertension and white coat syndrome at the same time. Humans are complicated. Cats are perfect. That's just how it is. So the lesson is simple. Track your numbers, know your patterns, bring your data. Don't let a 5-minute spike in the cold exam room define your whole health story. Class dismissed. Go drink some water. Alright. So that is it for this week's yarn. If you learned something or laughed at my trauma, just let you know you're allowed to laugh. I give you my permission. I laugh at myself too, because honestly, if you can't laugh at yourself, how else are you supposed to find humor in life? Go outside, touch grass? Absolutely not. I refuse. Soup. Go ahead and like, comment, and subscribe. Share this with someone who needs to hear they're not broken. They're just human. And remember, if I'm over here tracking my blood pressure with the same intensity of Kitsune trying to track a fly across the room, you can track yours too. We'll see you next week, or the week after actually, more than likely. Tiny cat steps, people.